there's a whole lot going on across the country about COVID and the pandemic. And we turn on the news and the cable news, and everything we hear is about what's going on, virtually everywhere but here, except when we hear our hospital reports. And so we just thought it'd be a great opportunity that we bring experts to the table today and talk about COVID-19 and the resources here and some of our responses here. There's no better person to moderate this than Sarah Northrup. And Sarah is a licensed clinical social worker and is the head of the adult behavior services at Texas Panhandle Center. Did I get that right, Sarah?
I think it's close enough, Dave.
I just know you're really good at what you do, and everybody in town knows who you are. And I just want to say this about all of the people who have joined us. And Sarah will introduce her panel. We have got such incredible resources in this community with mental health and behavior services. And we don't tend to recognize that. We've got authors that are actually on our panel today that write professionally and go across the country, in the state, and the nation speaking. So I just wanted to say to our panel, we've got great experts. So Sarah, it's off on you now, and introduce your panel and have fun.
Thanks, Dave. We really appreciate the opportunity to come and talk with you today. And thanks again to Panhandle Behavioral Health Alliance for having us. So let me just jump right in and introduce our panelists. We've got a great group here, and I can't wait to see what they have to say about COVID-19. So I want to introduce Andy Crocker. His role is to support county extension agents for family and community health in their efforts to educate older adults, caregivers, and the professionals who serve them. Since joining AgriLife Extension in 2003, Mr. Crocker has worked to develop resources to help older adults improve their health literacy through communication with their health provider and better medication management, navigate the internet and access reliable health information, and provide information and referral to grandparents rearing their grandchildren. Andy serves on a number of boards throughout the state of Texas, and he's a past recipient of Texas A&M AgriLife Extension Service Award for Superior Service as an individual and as part of his team, and a two-time recipient of the Texas Extension Association of Family and Consumer Sciences Specialist Award for Distinguished Achievement. Andy has a BA in biology and an MS in gerontology, both from Baylor University. Welcome, Andy, and thanks for joining us today. Our next panelist is Stella Hales, and she's joined with her mom, Reagan. Stella is a 12-year-old seventh grader attending Crockett Middle School. Stella started experiencing anxiety around the age of 10 and sought treatment. She continues with her treatment to manage her illness and wanted to share her experience so that others will seek help or treatment that they need. Stella is a straight A student, an avid basketball player, and is currently pursuing her musical instruments in electric guitar. We should have had you bring the guitar, Stella. She's also participated in productions with Emerald Little Theater and aspires to have a career in the arts or music one day. Her favorite city is New York City, which she has traveled to twice by raising money selling cupcakes that she loves to bake. Kind of makes me want to have a cupcake already. Reagan is also a native of Amarillo, and she serves as the Associate Vice President of Innovation for Amarillo College's new Innovation Outpost. And Reagan's also the proud mom of 3 kids, Jackson, Stella, and Scarlett, and her family attends Redeemer Christian Church, and she volunteers regularly with the Refugee Language Project and Snack Pack for Kids. Everybody welcome Stella and Reagan. And our third panelist today is Elia Moreno. Elia is the author of Permission to Rest and Living Intentionally, a book that depicts her own personal journey and hard-earned insights on the importance of adding value to the lives of others in just 90 seconds. She currently serves as the co-executive director of Texas Christian Community Development Network. In addition to that role, she also serves as founder and CEO of Living Intentionally Ministries. She's also the national program director for Beagle Communication Across Barriers, and holds the position of national director of community outreach for the No Excuses University Network of Schools, a growing network of 250 schools who promote college readiness for all students, especially those living in poverty. Elia serves on many boards and committees. She's bilingual and a master at assisting organizations and individuals who seek to implement fresh ways to connect with those living in poverty. Elia was selected as a 2015 USA Characters Unites Award winner by USA Network, the winner of the 2016 Suddenlink Community Impact Award, as well as bestowed the privilege of being named 2016 Amarillo Beta Sigma Phi Women of the Year. She was recently honored with the 2017 Amarillo Hispanic Heritage Lifetime Achievement Award. Well, we've got some busy folks that are joining our panel today, and I'm just very pleased and proud to be joining you today. So let's talk about COVID. We just cannot talk about that enough. So COVID-19 and mental health resources. So here's what I know today is that we have an average in the state of Texas of 5,300 new cases of COVID-19 every day. And here in Amarillo, we have our hospital capacity has reached a point to where it's over 15%. And so clearly people are struggling and having some increased or adverse effects on mental health related to COVID. And that's not just people who have been diagnosed with the virus, but those of us who have been in quarantine, those of us who are working from home. So it's affecting everyone in lots of different ways. And let me just give you this one statistic that I pulled from the Center for Disease Control. Folks that are associated with COVID-19 having adverse effects on their mental health, younger adults, minorities, essential workers, first line medical workers are reporting increased use of substances. They're having elevated suicidal thoughts and ideation, and an increase with anxiety disorders and depressive disorders. So that is a whole lot of information that's kind of being thrown at us at once. And so Stella, I'm going to start with you. Tell me how you've been dealing with COVID-19 and your anxiety in school and all of those kinds of things.
Well, quarantine was not my favorite, to be honest. It was like, I'm a people person, and when I'm with my friends is like when I'm at my happiest. So whenever I went to 7 whole months without seeing anybody, my like anxiety and my just everything bad just started skyrocketing because I had nobody to distract me from like myself and my thoughts. So my anxiety kind of just like took over me, and I was in like a real bad state of mind all the time. And when I went back to school finally, this is like the happiest I've been in forever.
So really it was just good for you. You had been isolated too much and you wanted to get back and see your friends and all of that kind of stuff. So are you still a straight A student with the first few weeks of school having passed?
Yep.
Mm-hmm. Okay, excellent. Mm-hmm. Andy, why don't you let us know how the older adults are faring during the COVID?
Thanks, Sarah, and thanks everyone for joining. So, it occurs to me a rural part of the Panhandle, isolation is probably not necessarily new to them, but loneliness is. And it's interesting to talk about social isolation. What we're talking about is physical distancing. Isolation, is an objective state of being by yourself, but loneliness, not meaningfully connected with others, whether it's real or just the perception thereof, can be really threatening. And you talk about anxiety and depression, and then that can start to impact memory function and have symptoms that look like dementia, when in fact, it really is just that lack of meaningful connection. But again, to go back to adults, especially handle, the impact is as great as we think it is because they're potentially used to it. And then the other thing is with isolation and loneliness specifically, research is showing that related specifically because of the collective nature of the everyone is going through the same. The impacts are less on all of us, other than not liking staying home all the time or things like that. There's this sense of I'm doing something that is greater than me, and so less of a detrimental impact, but certainly it is starting to wear several months on.
So Andy, let me ask you this, if like what's your work life been? I mean, were you dispatched home or have you been in the office the entire time? Because you work with people out in the rural communities. So what's that been like for you?
I want to welcome you to my spare bedroom.
Okay.
And
Wait a
there's
minute, Andy, this is not
open,
that kind of a conference.
yeah, there's an open door right here with a warm breeze blowing through the house, and I can hear the bells at Westminster Presbyterian. So, like, now it's great. Tell you that for me, I'm a routine person. It makes me nervous to deviate from that routine. And so, for about weeks of me working from home, I struggled a lot, not what to do or how to do it or a way forward, but I was out of my routine, and I wasn't able to function. And what's funny is I'm going back to the office a couple of days a week. I'm back in that kind of limbo where I'm not sure what my routine is and what I should be.
Elia, let us know what your thoughts are on the pandemic. How have you been managing these last several months?
It has, I feel like, exactly like Andy. I'm a person of habit and I like routine. So getting off of that routine has been a struggle. And just having the time to sit and research just stats on COVID and how it impacts people, period, kind of has stressed me out. From February to today, I've lost like 25 pounds, which is probably something good, to lose weight, but this is not the way I intended to lose the weight. Just because there's so much out there, just learning the population that I serve is compounded by this thing called COVID. And then just looking at the economic decline on top of COVID, and then the racial divide on top of that has really been a struggle. I understand that we have 30 million children in our country that rely on school lunches, and then schools being closed is a stressor, not knowing, are these children being fed?
I think that is so important. And I mean, you have lost the 25 pounds. I think there may be a few of us in the audience that may have picked up some of that extra COVID weight and just kind of feeding those insecurities, with comfort food. And during that period of time where we were, it was just the unknown. So it's been quite a struggle. And I appreciate you also bringing up the fact that, minorities are really suffering quite a bit more than most folks during the pandemic. And that is likely due to poverty. Would you agree?
Absolutely. In March of last year, let's look at March of this year, in Texas, we had 230,000 families that applied for SNAP benefits, which is double the amount that applied last year. So that tells you the stressor. We had 28 million people in our country as of 2 or 3 months ago applied for employment benefits, and only 44% of those actually received those benefits. So it is compounded. They weren't able to rush out to the store and buy the 10 cases of green beans or 10 cases of toilet paper that some were. They've known that struggle for a long time. And because that is my role, my purpose in life is to serve people struggling with poverty, that added a stressor to my life as to what can I do. And when you're in quarantine, you can't go out and serve like we had been serving. So I believe that people in the service field had that extra stressor, if that is their calling in life, if that is their purpose, not being able to do what they're called to do because we were all shut down for a while. If you weren't considered essential, you're at home. My husband has COVID, and I'm in quarantine right now. And you just think, you've done everything that you can to make sure you don't get it. And here we are. So for me, these past 6-7 months, these past 10 days have been more stressful than any other time, just because I know there's work to be done and there's nothing really I can do to help my husband other than keep the house sanitized, cook his meals, don't let him touch anything. We separated the house, half is yours, half is mine. My senior in high school had to move out to the guest house, and I'm just one out of the millions of people that have had to kind of figure out a new way of life during this time.
Absolutely. And I hope your husband, his symptoms are well managed, or that he's doing okay. Hopefully, because he is at home and has some support there. But also too, people are going through this months and months at a time. And then you have a COVID diagnosis, which that absolutely, it sounds like, kind of changed your life even more dramatically than it was changed before.
Yes. Yes.
Andy, what would you say to Elia and other people who are caregiving, and not just somebody with COVID, but somebody who's got some mental health issues? I mean, what's the best way a person can be supportive in these situations?
One of the best ways is to remember that you've got to take care of yourself, because if you don't, you're not going to be able to take care of somebody else. And so, remembering to still, take time for yourself, do things that interest you, meaningfully interact with the person that you're providing care for, but then also, try to get time away so that you get a break. And in a lot of caregiving relationships, the care recipient gets a break too, because especially in an instance where you're trying to care for somebody who may have some needs, they may want to get away from you a little bit. So, and then reach out for services. I think one of the things that we'll get to with this, and I actually see a question in the chat about accessing services. Take advantage of things not only to which you're entitled, but that are available in the community. And that may be a help from a friend to make a meal, or to stay with the person for a moment while you maybe even just go outside and walk around the block. Or something, but to really look for those opportunities to take time and get the break you need, and maybe to talk about Elia and Stella, get back on the routine that maybe you're used to or that you need in your life.
Awesome. So Reagan, what's been your experience living through the kind of the shelter in place, and also trying to help Stella manage her anxiety? What do you do as a parent?
Well, I think, we're all so used to being incredibly busy. So you're kind of used to going in this rhythm, and you have a routine even when you have a lot going on. And so in some ways, when everything stopped and we were at home homeschooling in the spring, it was almost more stressful, because we have 3 kids in our house, high school, middle school, and elementary, and I was working from home. And so there was a lot to juggle, and kind of everyone needed attention in different ways. And so we kind of had to find our own rhythms and how we could work amongst each other. What I think is interesting, since Stella's gone back to school a couple weeks ago, her brother actually got COVID. So we were all at home quarantining. And we had just kind of gotten back into a great rhythm with her own counselor, seeing her weekly and having conversations. And, we were really fortunate that her counselor adopted a virtual therapy session pretty easily. Even this week, while Stella's been at school, because she's missed so much school from quarantine, she was able to go down to the counselor's office in the nurse's station, do a virtual therapy session while she was at school, be able to touch base and get back into class without missing something. So you just kind of have to figure out what works for yourself. And then, and also just kind of give yourself some grace and some flexibility to know that it's not always going to work out wonderfully. My son is also a great student, and he's struggling catching up with school. And a lot of times you just have to remind each other to breathe. It's not perfect. It's going to be okay. So.
Stella, are you having a pizza delivered?
I don't know who that is.
Probably Amazon or something. I know.
Well, Stella, how was that transition from in-person therapy to the virtual therapy? I mean, your mom says it's, a little more convenient, but how do you feel like it's different, or do you maybe like it a little bit better?
Well, I love my therapist like a lot. So she was really like just flexible, I guess. I don't know what the word is, but she was really like just it was like the same. It felt like I was actually there with it. It felt like I was actually there with her. And it was pretty good. I mean, it felt like the same as regular therapy.
It wasn't, I think at first Stella thought it would be awkward.
Yeah, at first I'm always scared stuff is gonna be awkward. So I was like, this is gonna be a little weird. But it was actually pretty good.
Yeah. It was great.
Well, and I think we're all getting used to operating in a virtual, environment anyway, just with our conference here. And then, at work, you have virtual meetings, and, you just are really not with coworkers like we used to be. And so I think, we have to deal with some staggered audio, some doorbells. Maybe somebody's dog will bark here in a minute.
I don't know.
I think it's someone wanting a play
Well,
date. Sorry.
Stella, let me ask you one of the questions that we've gotten kind of in our chat area. And guys, I know a lot of you are mental health providers, maybe also work in the school system, and also family members of those living with mental health issues. You guys type in some questions that you want to know. These panelists are more than happy to answer anything that you've got to ask. But Stella, if you shared your diagnosis of anxiety with some of your school friends, how did they respond to that?
Well, I mean, kids in my generation, they
What are you saying?
they're kind of used to it, because I think a lot more kids deal with like anxiety and depression symptoms than people realize. So they were kind of like, oh yeah, I feel like that sometimes too. Or this is like normal. Like they weren't judgmental about it, because they probably dealt with at least 1% of it before.
Okay, that's awesome. So what is the thing that you think helps you the most with you to manage your anxiety day to day?
Well, my friends, whenever I'm like distracted or busy doing work or something, like my brain, when it's by itself, it kind of just like rambles and rambles. It just constantly is in panic mode. But whenever I'm with my friends or I'm distracted doing schoolwork or something, that kind of is what calms me a little bit. If that makes sense. Sorry, I don't know if I said that.
I mean, seeing a therapist.
Absolutely. If it makes sense for you, then it may absolutely make sense.
Mm-hmm.
So, and we've been really fortunate. I think one thing we learned, Stella started off with one counselor, and, it's hard when they're young trying to find a counselor. It's because it's awkward no matter what. And I think something that we learned is that you have to find a right counselor that fits your personality. And so it took us a little bit to find the woman that we're working with. And I think just once you find that click, once you find, who you gel with, I mean, Stella was like, I want to go see her. I miss her. I haven't talked to her. And so that's a huge relief on my part as a parent, when I know that the two of them get along. And so I think for any other parents or kids watching, just because you have an experience with one person that may not feel great or it may feel awkward, you have permission to go find someone else until you really find that great kind of bond and click. Because once you do, it just opens everything up. And I know it really did with Stella.
I used to hate going to therapy, but now I like miss it every week.
Well, and I'm so glad you said that, because I mean, that's true about any provider. It's about that relationship, and it's about, hey, am I going to trust you with the things that I need to talk to you about? And are you going to be able to kind of help me navigate through that? And, you just have to have that, like you said, Reagan, that click, and because if that relationship works, then talking about your issues is really so much easier to do.
Especially
Reagan,
right now.
what do you do?
Doing it virtually and in person, when it shifts, knowing that you're flexible with someone's great.
Reagan, what do you do to take care of yourself with all the kids and the homeschooling and
well,
the doorbell ringing?
It's funny because I've had to kind of create more discipline structure for myself, just so that I know during the day I have more bandwidth. If I need to help my kids, like yesterday, my son came home with all this homework and was stressed. So I get up really, really early. I set aside my own time to have quiet time and to exercise. I know for me, to have a little bit of stillness coupled with a lot of exercise is a great combination for myself. And then, stuff as simple as, taking a bath and just being able to lock the door and have 10 minutes to yourself. But I think really just kind of understanding that for me at least, being diligent about my schedule, so that if and when something does pop up, I know I've taken care of myself and I've filled my own pitcher up, so that I can help my children or the people that I work with or the folks that work for me.
Okay, that's awesome. Awesome. Ellia, what kinds of things for self-care are you doing that you might want to share with the group that, and especially now that your husband has the virus and, you're just facing some different struggles right now?
Right. Well, I wrote a book 2 years ago titled Permission to Rest, and it's about self-care and the importance of self-care. And I wrote it because I was struggling with putting time aside. I travel about 120 days out of the year, work across the country. And my publisher says that we write what we struggle about. And that's true. I can teach someone the importance of self-care, and you got to do it. You got to put it in your agenda. But for myself, it's hard to do because I feel like I have to keep working. So this has made me practice self-care because I am at home. So I run a few miles in the morning, and like Reagan, I'm in the bath every night for at least 20 minutes. That just allows me to not pick up the phone, not watch TV, the news, or have to read an article about what's happening.
It sure is a lot of information. I think we're just inundated right now. I mean, especially with the COVID, and it's just every day, new numbers, new fact, and how do you kind of weed through all of that? And considering the people that you work with, how do you help them navigate through some of these difficulties right now?
So I've created 3 strategies to help people that are struggling with poverty and those that serve those families. And it really is to step up, to do outreach, to call that person and just ask the simple question, how is your home life? Even if we assume someone's already receiving benefits or they applied for unemployment, doesn't mean that they received those benefits. So really checking in with those families. And number 2 is to scale up. Some of the businesses that were open before COVID will not reopen. Some of the jobs that were before COVID will not be there when we're out. So really allowing them some type of direction. Living Intentionally, the ministry in Amarillo, provides free GED for people that have dropped out of high school at some point in their life. So that kind of helps with that process to get them into some type of skill or trade. And then number 3 is to share correct information, because there is so much misinformation out there. So being able to do those 3 things, really being able to say, this is what I have in hand to do or to give, and then being able to say that that's all I have. That's enough. That's enough. And getting to that place is a struggle, but it's doable when you've had that conversation to connect with a family that you're serving, and then to be able to offer them some type of resource, and then to be able to share accurate information. We have 21 million more people that will fall into poverty because of COVID. So we have to make sure that the information that we're giving is accurate. So I was doing probably 3 to 4 hours of research for 3 months straight, just trying to keep the data and the facts in order. And that was helpful as I worked with communities across the country and the state to be able to share that, so that they're able to build capacity within the families that they're serving, because it looks different. Resources that we used to have are no longer in place. And some of that money will never come back to these agencies. Being supportive, if you're not a provider and you're just a citizen, I don't mean to say just, but a citizen that volunteers and gives, support your local United Way that is able to really disperse funds in a different manner. There's so much that we can do that does not take income. With the time that we have, that really allows us a place to self-care as well.
All right, excellent. What would you say is a barrier to people getting into mental health treatment at this point in time, if that you've noticed working with some of the families?
Shame. There's that stigma culturally as well. I struggled with sadness at the beginning of the year. Had I not been part of Panhandle Behavioral Health Alliance or known Shri, it would have been difficult for me to say, I need to find a counselor, I need to talk to someone, because we've been taught through this process and through these peace of mind conferences that it's okay. It's okay to say that, because so many people struggle. My role as executive director of Texas Christian, we work with low-income families, faith-based across the state. And so many of the issues are mental health, and that's just not something that every church is addressing. That's a barrier. We're not doing what we need to. And as Dave said earlier, that's our goal here in the Panhandle through Panhandle Behavioral Health Alliance, is to start that embedded just philosophy of it's okay to say I feel anxious, I am sad, I'm scared, this is too much for me, because taking a break, allowing self-care doesn't mean you're weak. It means that you want to continue doing what you're doing. So we all need a break at some point.
I just think it's so refreshing to hear Stella talk about like this is really no big deal, you know, for her generation. And I think we can learn a lot from that, you know, and just, you know, saying some things out loud, make them seem, you know, less large in, you know, looming at times. So, well, guys, we could talk all day, but I think I've got some questions here. I need to figure out how to do that, get Andy roped back in here. So Andy, here's a good one that I think you might want to address. What would be some ways to reach out to our rural communities that, you know, when people might be feeling a little more hopeless and isolated, but maybe people resist mental health treatment because of that stigma?
I think things like this end up playing a big role, because then you're sharing what your experience is. And you know, one of the things that we talk to caregivers about and other groups, and I'm sure many people are familiar with the concept of using I messages rather than you messages. And so, you know, be careful, especially with older adults, about you need to do these things, or you should do these things, or you seem whatever, because when we start those sentences with yous, where it's almost an accusation, you know, we're telling someone else what we think about them. And so just being able to share my experience, you know, I get sad too. I get lonely. I found this great resource. I, you know, struggled with X, Y, and Z, and this is how I dealt with it. And so sometimes that can begin that conversation. You know, look for opportunities for meaningful connectedness. You know, we talked about social earlier, and so we just assume that social media is the best way to interact and connect with people. But, you know, the neural hit that I get from hitting a like button on a post or something is not the same as meaningful connectedness with someone. And so, you know, am I connected to someone that I wouldn't pick up the phone and call, or that I wouldn't pull out a sheet of paper and write them a note or a card? And so be careful about what we think is good for connectedness, because sometimes, you know, it's just, like I said, giving us that quick sense of, okay, I belong, or okay, we're connected, when in reality, you know, the person that you went to high school with 20, 30, 40, 50 years ago, who just got a new Buick or whatever, I mean, you felt good saying congratulations, but that's not a meaningful connection. But check on people, and again, try to frame things from your perspective. Talk about your experience, and then relate that back to the other person.
Awesome. Do you have any resources for us, Andy, for the older population that you've been working with that this group might find beneficial?
So hopefully nobody from the Area Agency on Aging is on, but I'm convinced that the Area Agency on Aging can do anything. And even if they can't, they can
call them.
I know, 806-331-2227, and tell them I told you to call.
Shout out.
The other thing is, I am always amazed at the coping and the resiliency of the Panhandle. Just to go back to where I started, the Gray Cares group in Pampa. It's a ministry out of the United Methodist Church there that operates locally. Scott Hall in Sherman County Older Texans, SCOT. There are pockets of community resources and community supports all through the Panhandle that you wouldn't know unless you were standing right there in front of them. But that's the whole point of older adults, especially in our rural areas. When we are thirsty, we drink, and when we are hungry, we eat, and when we crave interaction, we don't need to discount that. We need to act on that feeling of loneliness or act on that sense of isolation, just like, we were hungry or thirsty. And so, whether it's calling the AAA and taking an advantage of a benefit to which you're entitled or that you've already paid for your taxes, however you want to look at it, or it's calling a local community group and saying, hi, I need or I want, or even if it's just, you're going to be coy about it and say, I want to get involved with your group because there's some self-serving purpose. Whatever it takes, reach out and let someone know that you need help or that you need resources or support.
All right, that is excellent. Elia, here's a specific question for you. You mentioned that someone encouraged you to get help with depression. What specifically can people say to encourage their friends to seek professional help for a mental health issue? That's a great question.
Well, I think for me, I had a conversation with a friend and she listened, and listening is great, but she got to the point where she had to say, have you ever considered seeing a counselor? And I really had not. That was not something that was anywhere within me. That was not a thought I had. I'm 50, so I've been 50 years without seeking outside help. So I was happy to take that idea and say, okay, maybe I can. And as Reagan said earlier, my first counselor, it didn't work. And never in my mind did I think, hey, you can try something else. Kind of like you buy a car, you didn't like that car place. Well, you can try another car place, or you get your hair done or your nails done.
Absolutely.
There's others to choose from. And Shri is the one that said, try another, try again.
Excellent.
When you have a relationship with people,
Excellent.
It's easy to be able to say that. The friend that I spoke with, I knew loved me and I loved her. So I didn't think of her words as catty. I didn't think of her as self-serving or it wasn't funny. It was just an act of love for her to say, you ought to consider seeing a counselor.
Hey, Sarah, could I chime in on that? Do you mind?
Absolutely, Reagan, jump right in.
Because I actually was having this conversation with a friend of mine about his daughter, and he'd never done any counseling or therapy. And the way I framed it to him was, well, if your daughter had strep throat, or if your daughter had a fever, or if something was going, or she needed tutoring in school, like if she was struggling with something, you would take her to an expert, you would take her to the doctor, you would take her to the tutor. Well, when someone's struggling with either anxiety or depression or a panic attack, it's the same thing. I mean, you're seeking help. I mean, we would do it if we have a toothache, we do it. If something else is going on, it's really no different. It's just taking care of yourself. And for him, I think that kind of helped him go, oh, well, I guess you're right. Never thought about it. And that's how I've framed it in discussions before with people. And that's how I talked about it actually with Stella.
Well, and aren't we all talking about health in general, right? And mental health is just a piece of that as well. But, get some help. You can feel different than you feel today. And really just kind of raising your hand. And, there's a whole bunch of people, even in our conference today that are more than willing to help. And hopefully I speak for a lot of professionals in the conference today. If I'm not your fit, I want you to find somebody who does fit. If I'm not it, go and seek some help elsewhere. But please look until you find that excellent fit. Reagan and Stella, I have another question for you guys. Were there any particular resources that you guys found helpful when you were at home that other families might be able to use, like if they were choosing to do the at-home schooling?
I don't know that we necessarily found anything. I think, for better or for worse, all my kids are pretty type A overachievers. So for them, the anxiety was coming with these new platforms and how you turn in grades and how you turn in assignments and, what's coming in and when it was due. And I think I just kind of made a gut decision at one point when I saw the stress level just kind of reach a breaking point, that I just said, you know what, just turn it off. Let's just turn it off. Let's go outside. We got a COVID puppy. It was kind of a total mess. She's a disaster, but we love her. And
You still have the COVID puppy.
Yeah, still have her. It was
Okay,
close.
good.
Still have her. It was scary at one point, but we would go for walks. But I think for us, just because we all kind of like to achieve and do everything well, when the tension and the stress just got too much collectively, I kind of had to make the gut decision to say, you know what, we're not doing any more work. It's okay. We're gonna, it's all right. Everyone break, go out. And I don't think that we really found any other resources. I think because we were all just trying to figure it out, and
winging it.
Yeah, completely winging it, and being honest with each other. Because I would tell my kids, I don't know what we're doing. I'm totally lost too. And so
the person in charge is not in charge.
Oh my gosh.
So.
But I think we have to give ourselves permission to not know what's going on, and to unplug and just say, you know what, in an ideal situation, sure, we might continue to get every homework assignment done on every timeline or this, that, or the other. But right now, this isn't a normal situation, and it's totally okay. It's all right.
Yeah.
And I think that took some stress. I mean, would you say that?
Yes.
Yeah.
Mhm.
This is my ultra overachiever.
Everyone.
Yeah.
Okay, we've got another question. Go ahead, Stella.
All right. One thing my therapist told me whenever I'm stressing about everything that's going on, she's like, what can you do in this moment to make things better? And when I was doing homework and I was stressing about literally everything and I was having panic attacks, all I could do in that moment was just maybe go outside and take a breath to calm myself down. Like I couldn't get 30 homework assignments done in 1 hour. So I'm just going to take a breath and calm down because that's all I can do in this moment.
Absolutely. And I think our next question hopefully is going to be good. And I want any of you to jump in on this, but have you noticed or followed any positive trends or habits that have come from the virus and these changes? Example, people going back to school, positive career changes, frequent self-care practices. Like, have you picked up anything positive from this time, these last 6-7 months that you would like to share?
You can.
Oh, okay. I started just kind of taking care of myself. I'm not trying to be like taking care of myself, but like I started kind of to focus on myself more because I used to kind of just stress about everybody else. Like she's my mom, and I was like, I have to be the mom of my mom, and I have to take care of her and my sister and my brother and my dog. When in reality, I just gotta take care of myself. Like that's it. And ever since I kind of got out of quarantine, I've started just kind of focusing on myself and doing what I like to do. Also, obviously, trying to be nice and friendly to others, but taking care of myself too. So, yeah.
Okay. So when you're full and doing what you need to do for yourself, then you probably have more time and attention for others, when it makes sense and it's healthy, right?
Because like if you're trying to help others, but you don't have anything left to give, it's like you can't help others and you can't help yourself. You got to help yourself first before you can help others, if that makes sense.
Right on. Right on. Andy, do you have anything to add to that last question?
For me personally, working from home and getting off of work and walking into another room of the house really changed the way I worked a little bit, and I found reading again, and simple pleasures like the Great British Baking Show. And for the first several months, I was going broke trying to buy butter so that I could recreate what they were making on there. But togetherness at meal times, even now, we've already mentioned the information overload and overstimulation and things like that. The TV goes off and electronics goes off, and mealtime is about togetherness, whether it's takeout from a local favorite or something that made here at the house, or whatever they baked on the show this week. So finding simple pleasures here, kind of the grow where you're planted idea, I guess, has been really, really good.
That's awesome. Elia, what about you? I know you've got your husband at home, but what kind of positive things are you taking from this time?
Well, the positive, I think that we have not seen humanity as beautiful as we have in the past 6 or 7 months. The world coming together as people, as one, to feed the hungry, to do what we can for our neighbor, to call and check on people. It has just been beautiful to see that. There's agencies all over the country that are reporting that. There's an agency in Houston, Attack Poverty, that just reported they've served more people in the past 6 months than they have in the past 9 years. And that means that's relationship. Andy has said it over and over again, the importance of connection. Number one thing is to connect with people. So isolation is just a scary thing for those that are struggling. So to be able to get out and pick up a box of food from people that you don't know. So I think there's so many beautiful things that have happened because of COVID. And when I am feeling down or isolated a bit too much, that's what I look to. That's what I focus on, is just the beautiful things that we as humans can do when we come together.
Well, I just want to say thank you to these stellar panelists today. Andy, thank you so much. Elia, Reagan, and Stella, you guys have just done a great job today, and it was a privilege to be your moderator. And once again, thanks to Panhandle Behavioral Health Alliance and putting the conference on today. And I think right now we'll take it back to you, Dave.